Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Plague. Introduction. Plague is a bacterial infection. It is usually spread by fleas or rodent bites. A certain type of plague can spread through the air. Medicines are available to treat plague. Symptoms of plague depend on what kind of plague a person has. The infection can lead to death if it is not treated. This program explains plague. It talks about the causes and symptoms of plague. It also explains how plague is diagnosed and treated. Plague. Plague is a bacterial infection. There are 3 types of plague: bubonic plague, septicemic plague, pneumonic plague. Plague is caused by bacteria called Yersinia pestis. The bacteria live in small rodents like rats and squirrels. When fleas bite rodents with plague, they become infected. The fleas can then spread the infection to humans and other animals. Plague can also be spread through infected tissue or body fluids. For example, this can happen when a hunter skins an infected animal without proper protection. Bubonic plague is the most common type of plague. Its symptoms happen quickly. People with bubonic plague may develop painful lymph nodes called buboes. Septicemic plague can cause skin and other tissues to die. This is more common on the fingers, toes, and nose. Septicemic plague can happen right after infection. It can also happen when bubonic plague is not treated. Pneumonic plague is the most serious kind of plague. It can be spread through droplets in the air from coughing. It can also happen when bubonic or septicemic plague spreads to the lungs. Pneumonic plague is the only kind of plague that can be spread from person to person. Symptoms. Symptoms of plague depend on what kind of plague a person has. Bubonic plague is the most common type of plague. Bubonic plague is named after buboes. Buboes are swollen lymph nodes. They often develop in the groin, armpits, or neck a week after infection. Buboes can be tender and painful. If the area of infection is not treated quickly, bubonic plague can spread to other parts of the body. Other symptoms of bubonic plague include chills, fever, headache, muscle aches, weakness. These symptoms happen quickly. Septicemic plague happens when the plague bacteria enter the bloodstream. It can happen right after infection or if bubonic plague is not treated. Symptoms of septicemic plague include abdominal pain, bleeding, chills. Other symptoms of septicemic plague include weakness, fever, shock. Septicemic plague can cause skin to turn black and die. This often happens on the fingers, toes, and nose. Pneumonic plague is the most serious type of plague. It happens when the plague bacteria reach the lungs. Symptoms of pneumonic plague include fever, headache, weakness. Pneumonic plague also causes a rapidly developing pneumonia. Symptoms include shortness of breath, chest pain, cough, bloody or watery mucus, respiratory failure, and shock. Pneumonic plague develops quickly. If it is not treated within a day after symptoms developed, it can be fatal. If you have symptoms of plague, contact a healthcare provider right away.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes. Plague is caused by bacteria called Yersinia pestis. Yersinia pestis live in small rodents across the world. Dogs, cats, and other pets can carry the infection. When fleas bite an infected animal, they can spread the infection to humans. Plague can also be spread by contact with infected tissue or body fluid. This type of infection is common with bubonic plague and septicemic plague. Pneumonic plague is the only kind of plague that can transfer from person to person. When a person has pneumonia from plague, the bacteria can be spread through droplets that enter the air when the person coughs. Pneumonic plague can also be spread by animals. This type of plague is rare, but it can cause death if it is not treated quickly. Plague is more common in rural areas than urban areas. It is most common in Africa. Plague is also common in the western United States and parts of South America and Asia. Diagnosis. Your healthcare provider may be able to tell that you have plague based on your symptoms and a physical exam. He or she will ask you questions about your personal and family medical history. Your healthcare provider may perform several tests to check for the bacteria that causes plague. They may check for the bacteria in your lymph nodes, blood, and lungs. Your healthcare provider may take an X-ray of your chest to see if the plague has reached your lungs. Treatment. Plague is treated with antibiotics. Antibiotics are medicines that kill bacteria. If your healthcare provider thinks you may have plague, you may be placed in a special room in a healthcare facility. This room will make sure you do not spread the disease to other people. You may be kept away from other people for 2 to 3 days while you get treatment. Some people with plague go into shock. This happens when a person's blood is infected with the bacteria that cause plague. Not enough blood and oxygen can get to your organs and tissues. This may be life-threatening. People in shock will be watched closely until the condition clears. Prevention. There is currently no vaccine for plague, but it can be prevented. Avoid contact with wild animals. Keep rodents out of your home. Remove piles of rocks and brush that can be used as nests. Wear gloves if you are handling or skinning potentially infected animals. Contact your local health department if you have any questions about disposing of dead animals. Use a bug repellent for outdoor activities such as camping and hiking. Repellents that contain DEET can be applied to skin and clothing. This can reduce the risk of flea bites. Use a flea collar or other flea repellent for your pets. If your pet becomes sick, contact a veterinarian as soon as possible.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Plague is a bacterial infection. It is usually spread by fleas or rodent bites. A certain type of plague can spread through the air. Plague also can be spread through infected tissue or body fluids. Symptoms of plague depend on what kind of plague a person has. Bubonic plague is the most common type of plague. Bubonic plague is named after buboes. Buboes are swollen lymph nodes. They often develop in the groin, armpit, or neck a week after infection. Septicemic plague happens when the plague bacteria enter the bloodstream. Septicemic plague can cause skin to turn black and die. This often happens on the fingers, toes, and nose. Pneumonic plague is the most serious type of plague. It happens when the plague bacteria reaches the lungs. Symptoms of pneumonic plague include fever, headache, weakness. Plague is treated with antibiotics. Antibiotics are medicines that kill bacteria. If your healthcare provider thinks you may have plague, you may be placed in a special room in a healthcare facility. This room will make sure you do not spread the disease to other people. Contact your healthcare provider right away if you have plague symptoms. Plague can be life-threatening. Thank you for using Explain.